Hello, Jay here. I want to make sure that everyone knows a new group is forming in my online yoga teacher training starting in January. It's a year-long program and a return to the way that I learned yoga, which was not through a standardized curriculum, but rather a co-creative process that had an individualized structure. It fits to you rather than you having to fit to it. And I just couldn't be happier with how the inaugural year has unfolded. As a way to share with you more about the program, I've recorded a series of mini talks with people who are currently participating. Today, I'm talking with Jamie. Hello?
Hello.
There you are.
How are you doing?
I'm doing okay, Jamie. How are you?
I'm all right.
You know, in getting ready to talk to you, I was thinking about you and what is it that I would want to hear from you about the training, or what am I curious about to hear from you in regards to it?
Yeah.
And what occurred to me is that you were already teaching and well established as a teacher, and you have had other training and stuff.
Mm-hmm.
And I guess from that vantage point of doing another training, my hope would be that it added to your repertoire, your knowledge base, or your effectiveness as a teacher. And I guess I'm curious if it did that at all.
Yeah, I think what it's encouraged, all the kind of questions I had about my own teaching, not being in a kind of yoga studio community type thing, am I a yoga teacher, or am I just a mover and breather arounder person?
Yeah, because that's a big question for folks who are kind of in the somatic movement world / yoga. Sometimes am I even a yoga teacher anymore? I get what you mean.
And I still kind of question that, because with I think the thing is that I've got a bit of a hang up about the yoga philosophy, because I just find it so vast and so kind of unknowable. And although we spent a good, 3, 4, 5 months on yoga philosophy, and it was great going through it, and it made me realize that deep in there, within me, I'd actually remembered quite a lot of what I'd learned in other trainings, and especially more traditional one like Shivananda, where you get quite a lot of it.
Yeah.
So that was quite a comfort to know that I had taken something in. I had actually learned something, but then it's just not in my nature for my classes to be. I would never be a yoga philosophy teacher, and it's not something I really offer in my classes. It's certainly kind of in forms and just, I don't know, it's in the background marinading, and then whatever comes out of me comes out.
What's interesting is I've also heard you share in our meetings about things that happen in your classes, different students who came and interactions you had with them, some recent ones, some of those very magical experiences you had in your exchanges. And to me, you are teaching yoga philosophy to your people in your class, even if you're not talking about non-duality or text or anything.
Yeah.
That you communicate a lot through gesture and your behaviors, and it's not always so verbal like me.
Yeah, definitely. And that's kind of where I feel most comfortable, and because of where I teach as well, with kind of, I'm not saying that people who go to yoga studios are not ordinary, but, because I teach in gyms where people are going there with a kind of a fitness thing, but then I am teaching a yoga class, which isn't it is a fitness class, obviously, but it isn't. It's definitely a yoga class. I would really, say it's definitely a yoga class, because I feel, I've had quite a normal kind of working life, like ordinary working people, and I think somehow, I'm recognizing that is one of my strengths of inviting people into this, slightly creative world of, moving your body, breathing, bringing your attention to how you are that day. And then, there's perhaps the invitation with that it may affect either what you're just doing in that present day. It might affect what you're doing for the rest of your life. It might affect other people in the room. It might affect the planet. You know, there's this kind of almost like speck of dust, and then the whole universe kind of in the whole kind of thing in the class, which sounds very lofty for a class.
You were just teaching yoga philosophy. That's what you were doing.
Like today, there was a thing, like there'd been a storm in real life. There'd been a storm, and so we were doing a bit of warrior, and I was imagining this storm, so I just kind of verbalized it, and I said, you know, here we are in the warrior, and I can't remember the exact words I used because it was just in the moment, but it was that thing of, in my mind's eye, we were seeing that storm kind of, you know, going over the horizon of the planet, getting further and further away. And, you know, we were there as, you know, warriors standing steady but buoyant. I don't like rigid warriors. And, you know, and there's that knowledge that that storm, you know, might come around the planet and round the other way and catch us in another way, but we'll still be there kind of standing steady with our breath in that moment, ready to kind of take it on. You know, much in the way that you know, digress in your classes and stuff like that. I've certainly learned that from you and feel more confident about just speaking the moment, or whatever you call it. The training has taught me, I think, to be really comfortable in just being yourself as a yoga teacher than trying to put on any kind of, you know, jacket you think a yoga teacher should be, you know, and that will change as you change. And so, you know, for me, I really like your style, the kind of the gentle yoga. I think your classes are really kind of just strong, kind of basic hook. And I feel that I can, well, I have used that. I've used it actually for years, but I've always kind of gone off it. I've weaved in and out of it. And I bring in my other experience of somatic inquiry. And then it keeps changing. It keeps evolving. Like, you know, recently I've kind of returned to 5 rhythms dance. And it's kind of, I'm getting the urge to, you know, move people a little bit more out of their kind of comfort zone. You know, I'm wondering how to kind of navigate that, you know, and so I'm feeling freer to be myself, and that's, of course, a changing self. You know, there's nothing static about being a yoga teacher, and if there is, then I think you've lost it. You know, you never stop learning, do you? It's just like constantly evolving. So this whole year with these other teachers and you has just been, you know, adding maybe a little bit of a cement into my loose wall of kind of yoga, kind of making some things feel just a bit more kind of steady in me, as in more confident.
Well, that's beautiful, Jamie. I couldn't be more happy to hear that. And I would say, just for you to know that our friendship and work together over this year, and even before this year, it's just been super invaluable to me, because a lot of the things that I'm interested in exploring, and you and I have discussed it, you're kind of exploring too. And the fact that you do communicate so honestly through your person, it's just been an inspiration for me too. So I'm so grateful that you've been around. Thank you.
Yeah, I find it difficult to not talk honestly, because I haven't got the words to dress it up in a fancy or manipulative way.
I know, it's a great quality that you have. And it's just like I said, it's been a really valuable resource for me to have you in the group. So to just take this moment, I'll tell you again, I know I've said it before, just thank you for everything.
Yeah, well, thank you, Jay. And you know, thank you as well for your whole kind of, I mean, I've said this before, like, I think at the beginning when I started coming to the teachers thing, I thanked you incessantly about the podcasts. You know, it's such a valuable library, you know, and it's just such a great resource. You know, and even if, you know, you're kind of not necessarily interested in the people you have on at times, there's always something that you just hear that's different, or such a great thing, the podcast. It really is.
Thanks. I mean, I use it to keep my own juices percolating. So I'm glad that it does that for you too.
How do you feel the training's gone for you then?
I mean, for me,
switch it around.
I love that. I'm open to that. I think that the training, it definitely exceeded my expectations. I was sort of nervous about it. Mm-hmm. And to be honest, I've had a few of these mini talks with other people in the training too. I felt less confident with other people who were doing it than you, because you and I had such a long relationship before doing it.
Yeah.
But I think my concerns were mostly because I am going against the grain in terms of how a lot of people do trainings or how I decided to structure it. And so I just wasn't sure how it was going to pan out. And so far, as far as I can tell, it's panned out, like I said, better than I would have hoped. So onwards and forwards.
Yeah, I've enjoyed kind of committing myself to the whole kind of year to just keep thinking about my practice, my teaching practice, and all the stuff we talk about. Yeah.
Well, very cool. We definitely, we have a little time left, like maybe 2 more months. And I feel like I'm going to see you. So it's not like an end,
No, I think I'll be definitely staying on the teacher's call,
cool.
Because it's just so useful, just really, really useful, And I've met some people, like obviously I've met Suzanne. Do you remember Suzanne?
Yes, I remember Suzanne.
Well, so I'm now going to do a 2-hour workshop in her next yoga retreat.
What?
Yeah. Which is great.
That's cool. See, that's where the online stuff is really working, because now you've made real connections offline too.
Yeah. And I helped Nigel moved into his new house the other day.
Oh my gosh.
Yeah.
Oh, that makes me so happy, Jamie. My UK friends are hooking up over there.
Yeah.
Very cool. Very cool. All right. Well, Jamie, listen, I'll see you soon. I'll see you in the teacher's call, maybe even later tonight if you're going to be there. Otherwise, I'll see you soon. All right. Thanks for doing this.
Yes. All right.
All right. Bye, Jamie.
See you. Take care. Bye.
Okay. The moment has come as the button pressing has commenced. This is Jay Brown Yoga Talks podcast. My name is Jay Brown. Welcome to you if you happen to be new here today. All the rest of y'all, what's up? How's everyone doing? Today, we are continuing with a series of conversations in which I attempt to unpack my pain, which is really nothing new around here. But today we are definitely going to be getting a fresh take. My guest is Rick Olderman. And I don't want to give too much away. I share with Rick the story that brought us together. Let me just say that Rick has what he likes to call a systems approach to biomechanics and addressing pain. And something happens in this episode that has never happened on the show before. You see, Rick is going to give me an actual assessment using his system in real time. You're going to get to hear it. I actually stripped down to my boxers and Rick did his thing with me. And listen, I don't want to give too much away. We can talk about it more on the other side. But I will say that Rick observed things and gave me ideas to work with that I just haven't heard anywhere else. And they've absolutely been useful. I've been playing since, and it's a lot, and it's definitely something I haven't ever heard before. So all of you anatomy geeks out there, all of you movement and gait analyzers, this one's got your name on it. Now, also, this was recorded a few weeks ago. At the time, I was 4 weeks into my 5-week course of physical therapy. I have since finished that 5-week course of physical therapy and had my follow-up meeting with the ortho sports medicine doctor. I am going to tell you about the result of that meeting and my plan going forward on the other side of today's conversation, because I want you to hear Rick's take first, which will absolutely be informing my choices, I think, to some degree. In any case, it was truly a pleasure and a very stimulating conversation for me. I'm very glad to be sharing it with you today. Real quick before we get to it, I want to express gratitude to our podcast premium subscribers, because without them, we really couldn't be doing the show the way that we are. Today, I specifically want to say thanks to Anna and Tosowitz and Marika. Cheers to you, Anna and Marika. Thanks so much for supporting the show. If you're newer around here, the most recent 52 episodes of the show are always part of our public feed. We also have a premium subscription that gives you access to the full archives. And really, it's the way for people out there to show their support. It's choose your rate, cancel at any time. And if you are not in a good financial position right now, and there's an old episode that you really want to listen to, just email us. We'll definitely hook you up. But if you have even a little something to give, it makes such a big difference. We're so grateful to the people who are doing that. To learn more about becoming a podcast premium subscriber, along with all of my other stuff, the teacher training and all my other things, go to jbrownyoga.com. All right, y'all. Like I said, I'm going to touch base with you on the other side. We've got a lot to get to, so let's go ahead and do that. Let's listen to this conversation that I had with Rick Olderman. Hello?
Hello, Jay.
Hi, Rick. Nice to meet you.
Nice to meet you too.
I'm really glad to have this chance to talk to you. Thanks for giving me your time today.
Oh, thank you. Thank you very much. Yeah, I'm excited to be here.
Well, I will say that there are a couple of different ways that episodes get generated for this show. And yours is kind of a convergence of two. One of those avenues that they come about are sort of like where the winds blow me. Like I'll get a random email about someone like I did with you. I guess you have a forthcoming book. We can talk about it some.
Oh, yeah. Uh-huh.
And I got an email about you. And frankly, it's an email I would have normally ignored. I'm going to be frank with you. I normally don't bring people on the show just from like PR emails necessarily. But for whatever reason, that email about you happened at a very particular moment in time for me personally, which is the other more primary way that episodes get generated for this show, which have to do with me dealing with my own pain issues and being honest about that. And frankly, you know, that's one of the main things that this show started with. Started it like 7 years ago. And it was at a time where I had a yoga center for 10 years and was started becoming a little bit more considered like a more senior teacher in the world. But things were kind of falling apart, not only with the business, with the yoga center, but like with my body. And it was also at a time where there was what people were calling like the Instagramification of yoga. So there was a lot of yoga teachers on Instagram and people scrolling on Instagram and hashtag every damn day and hashtag live your best life. And so if you were trying to get a sense of what a yoga teacher's life was like from scrolling on Instagram, you would have this particular kind of glamorized idea about yoga teachers. But all the yoga teachers I knew who'd been in for a little while were like having chronic hip pain like me. And I even remember there was like this one more prominent teacher who had gotten like a hip replacement surgery on the down low, like hadn't told anybody about it.
Oh, gosh.
And I remember thinking at the time, well, one, either that person thinks it's just like a personal matter and it's not anyone else's business for me to share that with them, or they thought it was going to like harm their business reputation. Either way, I felt like there was red flags for me. So some of my earliest intros to this show are me like breaking down and crying and like admitting that I have this like persistent pain in my body. So for the last 7 years, a lot of what I've done as a teacher and with this show has been about addressing that. And I've done a reasonably good job of it, I think. I ended up coming up with the slogan, gentle is the new advanced. I adopted this like slower, more gentle therapeutic approach because I had been doing more aggressive styles that I think were really exacerbating problems for me. So over the years, my whole trip has been about pain, easing pain. And I would say I haven't been doing that from a biomechanical model. We can talk about your pillars of pain
Sure.
that you talk about. I haven't been using the mechanical one so much. I mean, I've studied it, but that's not been my focus. I've been really looking at it from like a more like biopsychosocial kind of down regulation of the system and other kinds of things that have definitely helped me. All of this is to say, I turned 50 this year. And, I've always had some like red lines for myself about whether or not I feel like I am adequately addressing my pain issues or not. And where I've experienced pain the most is my hip, but I have had pain like in all kinds of places in my body. I recently had someone on, we were talking about hypermobility syndrome disorders. I could be a high candidate for that. I don't know. It's not a diagnosis necessarily, but what I would say is that recently I had like a couple of flare-ups in my hip, and I just felt like my tools don't seem to be working as well as they do, or I felt that I was maybe being limited in my scope in terms of like not looking at it at a more biomechanical way. So I went to my doctor. She ran her test. I mean, I've got great ranges of motion. It's not like I'm in distress. I'm functional, but I definitely have this pain for many years now, like 20 years, I'd say I've had this pain.
Okay.
Now, we did a bunch of assessments. We both kind of came to the same theory that if there is tissue damage, it's maybe labral tears, but we both know that that might not be why I'm having pain. It might just be a symptom of the fact that I'm having this pain or whatever.
I love how you just thought about that and phrased that.
Just to let you know where I'm coming from. So in any case, we had the x-rays done. Everything looks fine. She said the next thing, if we wanted to try to get more imaging done, would be this MRI with the injection where you can see other tissues. My insurance company won't pay for that until I go to physical therapy first. So I am 4 weeks into my 5-week prescribed physical therapy before I could get them to pay for the MRI. Now, I also know from study that, if you believe something's going to work, you give it way more chance that it will work than if you don't believe in it. So I went into my physical therapy really wanting to be open-minded. I've really enjoyed the process. I like the physical therapist. I will say she's just recently out of physical therapy school, so she's a somewhat more inexperienced physical therapist, but she's very passionate and I like her. And it's been really great to see my body through that lens more. Mm. And I'm still a little bit confused about some things. Yeah. So in any case, that's maybe a long-winded way. You think of it as an introduction, maybe, as to what made me be like, okay, I want to talk to Rick. And then now I've been getting ready to talk to you, and I'm like, even more so, I'm very curious to speak with you. So all of that is to say, again, thank you for being here and letting me work through some things with you today.
Yeah, that's by all means. Let's try and solve your pain. Well, I'll give you whatever I can to help you.
Oh, well, that's so sweet of you. Before we focus on me, because I started all about me, I would like to get a little bit of background, because I know you're into systems thinking, and so am I. I'm always very curious about kind of the viewpoint or the lens that someone's looking at someone's body and how they want to address their pain. And I'm curious about how people get to those lenses that they have. So I read that you did physical therapy in 1996, I believe. And at some point, it says that you realized that your physical therapy education left you unprepared. And I'm curious about that. Was there a moment? Was there some experience where it became obvious to you that there was something limited or that you needed more than what you were getting from that physical therapy education?
Oh, yeah, by all means. And what it was my failure to help people. So my first job out of PT school, anyone who came in with acute issues like sprains, strains, post-surgery, pre-surgery kind of stuff, great. I could help them with that. But anyone with any kind of chronic issue, it was hit or miss. And I didn't feel that was good enough for me. I thought I should have these answers. They're coming to me because I'm a physical therapist. I should have these answers.
I clearly didn't. I was a miserable failure. I was sunk into a deep depression because of it, and almost quit physical therapy. And I realized, you know what? I've just got to figure this out. So it wasn't until I moved to Denver and I started working at a high-end health club. And once a lot of people learned that there was a physical therapist there, my schedule was immediately packed. And these are youngish people, 20s to 40s, well-to-do, had the resources to go to any practitioner they wanted to, had been to many practitioners, and still had pain. And so this is one of the things that helped pull me out of my depression was I realized, oh, it's not just me. It's a lot of medical providers don't have the answers. So I was just like, oh, wow, this is a big problem all over medicine, not just with me. And so that's when I thought, gosh, I've got to devote myself to try and figure this out. And I think I have figured out most of it.
Wow. Well, I'm curious then, if the physical therapy training wasn't enough, what else did you draw upon? Now, I have to say this is maybe another little synchronicity because I've been trying to get Hanna Somatics on the show, and I've heard you mention it in some of your podcast. Yeah. You referenced this is a Hanna Somatics part. So I know that may be one of the influences. A lot of yoga teachers have been looking at different somatic movement modalities as well. So is that one of the influences that has shaped you, and what other ones might you have also been influenced by?
Yeah, I won't bore your listeners with going into great detail about it, but I'll give you a brief overview. So inherently, I believe that something I was doing and something these people were doing were causing their pain. And so in PT school, what we are taught is a component approach, which means we are taught 1,000 tests to drill down and figure out exactly which tissue is damaged. Or you have, like you took, an X-ray or MRI. We have tons of scans and tests to figure out which tissue is damaged. 0 tests tell us why those damages are occurring. And so in my sense, intuitively, I felt, if I don't understand why these injuries are occurring, how can I possibly help them? But that's not the way PT was addressed in school. It was just, this is the tissue that's damaged. This is how you're going to treat it. Nothing about the why. So then after I got to Denver, I was just like, well, what physical therapist do I know who talks about movement, how we move as it relates to pain? And Dr. Shirley Sahrmann's name, I remember one of my classmates was talking about her. So I looked into her stuff. I read her textbooks. She was a PhD PT out of Washington University in St. Louis. She teaches at the program there. And she has a whole seminar series. And I took all of those, and it was like the world had opened up. This was the answer I was looking for. And so I just consumed her information and applied it to my patients. And lo and behold, so many people were getting better. I'm just like, this is it. But then the way it works in medicine is the better you get, the harder the patient comes knocking on your door. And so, soon her information was helpful, but it wasn't really solving everything and everybody. And so I thought, I've got to look elsewhere. Where are these other answers? And so that's what led me to fascia research and Thomas Meyer's anatomy trainings. And so Dr. Sahrmann identified 3 primary patterns of dysfunction that cause most back pain. Thomas Myers identified fascial superhighways running through the body from head to toe. And his fascial superhighways corresponded almost exactly to Dr. Sahrmann's 3 patterns of biomechanical dysfunction. So I thought, yeah, exactly. That's what, ding, ding, you're on the right track, right? So what his information taught me was I could look along this whole fascial superhighway to look for answers that Dr. Sahrmann maybe hadn't thought about. For instance, if you're dealing with a neck issue, looking at the foot, because fascially it's all connected, right? So anyway, I started getting more people better. I'm just like, yes, this is it. But then the next tier of patients came knocking on my door, and this tier of patients seemed to have some kind of battery that was charging their systems to be locked in this dysfunctional pattern of movement. And I'm just like, gosh, what's going on here? And finally, I was led to Dr. Thomas Hanna's work, Hanna Somatics. And so they have no research to support anything that they do. So there was a big leap for me as a physical therapist, because we're all taught, evidence-based, evidence-based, evidence-based everywhere. You can't do anything that's not evidence-based, but there's no evidence. But I knew personally that this was a helpful thing, because I had a call from someone who used it, and it was a game changer for her. And I thought, this person had the problem that I think I'm running into with my patients, and she was solved in one session with Hanna Somatics. I've got to figure this out. So I went, and lo and behold, the 3 patterns of dysfunction that Dr. Thomas Hanna identified are the same as Dr. Sarman and Thomas Myers' fascial lines. So Dr. Sarman approaches it from a biomechanical movement standpoint. Thomas Myers approaches it from a fascial standpoint. Thomas Hanna approaches it from a neurological standpoint, tying into deep reflex patterns in our bodies. And so when I saw that all 3 of them are looking at the same 3 patterns, I'm just like, holy smokes, this is it. So when I integrated all 3 of these together, and then it just blew the roof off of all of my outcomes for all of these really difficult chronic pain patients. Everyone was getting better implementing this blend of all 3. And none of the 3 really went into deeply was, what are we doing daily that's contributing to these 3 dysfunctional patterns of movement? And so that's what I've been figuring out these past 20 years, is what is it that we're doing that's causing these patterns of dysfunction that are occurring? And so that's my approach, basically, is not only identifying these patterns, but what are we doing that's causing them? Sorry, that was a little long answer.
No, that was exactly what I was looking for. That was exactly right, because that's the intersection that I find most interesting about what you're doing. That intersection of different lenses, essentially.
Yes.
And the idea that there is something that they're all pointing to from these they're looking at them from different angles, but they're all kind of pointing to something that's the same, and you're kind of connecting them. I find that very interesting. I guess the other thing I'm curious about is, it seems like, as you said, you have kind of different tiers of situations that people might present. So I imagine that how you address them would be different depending. It seems like sometimes you're targeting glutes. We can talk about firing glutes when you're walking, because I know other people are saying the same thing that you're saying about that. And so sometimes it's like, oh, that person's got, and that's what I've been doing with this physical therapist, is my hip, really. It's like, I have no problem with my ranges of motions, and so we're like, okay, well, are there certain muscle groups that I haven't been engaging? And we have found some. We've been targeting different kind of muscles, different exercises, clamshells, my hip, and different kind of things to try to see if we can find areas to strengthen and see if that changes stuff. But it seems like that is still about her trying to kind of address a symptom in a certain way. It's like the targeting of, it's almost like an engineering problem, it seems like. And I'm questioning whether my pain is for lack of strength and range of motion, really. I don't know. It could be, but I guess the question I'm trying to get to is, do you think that your work is more about that kind of targeting, or is it more about retraining how people walk and sit?
It's everything. So what I call my approach, and you mentioned this already, is a systems approach. So I've broken the body down into 2 musculoskeletal systems. All right. One is the rib cage down to the foot for the lower body and back, and the other is the pelvis on up to the head as the upper body system. Those are 2 systems that we can kind of divide the body into. Of course, they cross, and we can talk about how they cross. But for most issues related to the back and lower body, I would use the lower body system exam. So in that exam, it's a very comprehensive exam, but it's very short and simple. It sounds like a paradox.
No, I've heard that before. Simple solutions are often better for complex problems than you try to make complex solutions. I know what you're talking about.
And we can talk about exactly how this works in a person, if you want to. But anyway, so when you look at things from a system standpoint, from the initial evaluation, you see everything that's wrong. And you prioritize those things. So there's no guessing, really. I see all the problems. I don't know which is the primary problem for you, but based on my experience, I automatically prioritize these in my head because most people, this is the primary, this problem that I found is the primary issue. And so when you talk about gluteal strength, I have no doubt that your glutes are strong. And that's probably not where I would focus. What the problem may be is the gluteal activation. That neurologically,
like the timing, you mean?
Well, your brain is not neurologically activating the gluteals at the correct time during your gait cycle, likely. I'm going to guess that you may have an anterior femoral glide syndrome, and it may be exacerbated by something called anteversion or retroverted femurs. So we can look at that.
We can talk about that because I was educating myself about that on your video, so we can talk about that. But
yeah, we can, and I can look at it in you right now today if you want to.
Wow, we could try what I would say. And it's so funny you say that because I talked to somebody recently named Esther Gokhale. She's got a method too. And she's got an idea about a J-shaped spine, but she does a bunch of, it seems like my question is what you're talking about. This assessment is basically like a postural and gait analysis that you're doing, right?
It's much more than that.
Okay.
It's much more than that because it's not, posture and gait are important, but we have to understand the components that go into that posture and gait too. And so it's not only looking at the big picture, it's looking at all the smaller systems within that big picture and simultaneously seeing the small problems and the systems at the same time.
All right. Well, I want to come back to the how you're able to see that, but let's say that let's put a pin in that.
Yeah,
your ability to see that by looking. But what I want to come back to is what you kind of gave a potentiality about these femur rotations, as I understand it. Why don't you say a little bit more about that? I know that's a big part of kind of this lower body system as you sometimes you're describing.
Yes.
What do you? It seems to me, and this is a question I have, that it must be something that you've seen quite a bit in people that you've decided to like, oh, this is a basic principle or concept that a lot of people could learn from as opposed to like something very individualistic or specific. Is that correct?
You are absolutely correct. It's probably one of the easiest things to test and the thing that no one ever tests. And if they do test it, a lot of people don't understand how to implement it in terms of how to understand pain and solve pain using it. So you'll find out in just a second. It's a really simple concept. All right. Okay. So I've got a skeleton in front of me. All right. And if you look at if you all Google a picture of a skeleton, you can see, it facing you.
All the yoga teachers who listen to this show had to look at them for their teacher training. So if everybody's seen one, they know what you're talking about.
Right. So if we drill down into the thigh bone, the femur, all right, you'll see that it's going into the hip socket and the knee is pointing forward. Well, that's an average. So many men have femurs that are actually twisted to the outside. This is called retroverted femur. All right. So even though it's sitting correctly in the hip socket, the shaft of the femur is twisted, so the knee should be pointing outward. All right. And most women, more than men, they have the opposite. They have anteverted femurs, which is the shaft of the femur twisting inward. Now, you can have one femur that's retroverted and one that's anteverted or whatever. All right. But what happens is this has enormous implications as to what is happening at the hip joint, at the knee joint, at the foot, at the pelvis, at the back. If you don't understand the concept of femoral retroversion or anteversion in whoever you're working with, then you're missing a massive piece of the picture for this person. So everyone has some degree of rotation. It's a matter of degree, right? And because rarely does anyone ever have, a 100% zero neutral, twist in their thigh bone. And so, for instance, the implication for this is, if you have a retroverted femur where the thigh bone is twisted out, most of us are socialized to believe that our feet should be pointed forward when we're standing. Okay? So if your feet are pointed forward, and in fact, you can do this right now. I don't know, Jay, if you can stand up where you are.
I probably can, yeah.
Yeah,
sure.
Just go ahead and stand up.
Hold on.
All right, so just stand up. I can't really see your legs, but that's okay. It doesn't
you want me to move
really
back?
matter.
I might not be able to hear you.
That's okay. Yeah, don't worry about it. Just stand where you are. That's fine. Because we're just about feeling something. And folks at home, you can do this too. So I want you just to stand, walk in place for a few steps just to make sure your feet are where you normally put them. Mm-hmm. Look down at your feet. Mm-hmm. Are your toes pointed forward, or are they pointed out to the side, or are they pointed in? How about you, Jay?
Honestly, they're pointed ever so slightly out, because this is actually something that I just, to your point, like I was trained, as many yoga teachers were, that proper alignment was parallel feet. But at some point, I let go of that and found that if I let my feet turn out just a little bit, it felt better. So I let go of making my feet be parallel.
Yeah. So let's talk about why that feels better.
Yeah.
So continue standing there, looking at your feet. Mm-hmm. All right. And now I'm going to ask you to turn, Jay, your feet out even more. And folks at home, you do the same. Mm-hmm. All right. Now, go ahead and bend your knees a little bit and straighten them out again. Just all that kind of, feel how that feels. Mm-hmm. Okay. Now turn the feet back to where you originally had them.
Okay.
Now I want you to pay attention to the sense of with the effort that's occurring in your legs right now. Do you feel more tension in your legs to keep your feet where they are now versus pointed more to the outside?
Do I feel more tension to keep them where they are as opposed to turning them
for instance, the inner thighs, are they working harder? Do you feel more stress? Do the legs feel more tense to keep them pointed where they are now versus out? And I don't know the answer. We're just asking.
I would say no. I don't feel like there's more tension to keep them there.
I would say the vast majority of at least men who are listening to this would say yes. All right. Mm-hmm. So the degree that you're pointing your toes out is matching your femur shape. Well,
interesting.
Okay. So most people, they're not aware of turning the feet out or in and how that affects the leg up the chain.
I think that makes a lot of sense. That wouldn't have been true for me a little while back, just so you know.
So what are we doing? Well, by turning the feet out a little bit, you're likely aligning your foot position with the shape of your thigh bone. If your feet are turned in excessively, then what is turning that in? Well, you've got all of these inner thigh muscles that are turning that in, and you'll feel your quad muscles engage more. And so you've got all of this tension that you're creating in your lower body system to keep the foot in the place that you believe you're socialized to believe is the correct place, right? And to follow this up, most people, especially guys, when I tell them this, they all say, "Oh, you want me to walk like a duck?" Right. So what that means is that you're judging the foot position rotated out as something negative, right? Mm-hmm. And so we've got to understand that our socialized ideas of what we think are good or bad are just that. They're socialized ideas. And our body is actually going to tell us whether they're a good idea or not, because pain will occur, right? That's what pain is. It's a signal that something is wrong. Mm-hmm. Okay, so that's the idea of femoral retroversion and anteversion. And just I'll just go one more second with this, and then we can move on.
No, it's good.
But if there's a big thing, like women complain about men when they sit, that their knees are wide apart, right? Man spreading, right?
Yeah.
And women sit with their knees together, right?
Crossed or whatever. It's more like ladylike or whatever,
so
right?
This is the concept of retroversion and anteversion being played out in sitting. Men typically have more retroversion. So in order for us to squeeze our knees together, it takes an unusual amount of effort for us to bring our knees together, right? Whereas women, it's more easy because their femurs are already shaped to be together because of this anteverted twist. So I interviewed an NFL lineman, and because he had a problem with retroversion and anteversion, and we solved it. But anyway, I explained this little thing to him. He says, "Oh yeah, if I had to sit with my knees together, I'd start sweating." Because it's a lot of work for guys to do that, right? So if anyone complains that you're sitting man spreading, you can just say it's a medical condition.
It's the shape of my femurs.
That's right.
Well, I will say that this is something that's come up for a lot of yoga teachers, because some approaches in yoga were kind of teaching like an idea of one right alignment. Correct. And that proved so problematic for the reason that you're pointing to here as well, that people's bones are sometimes shaped differently. So the idea that everybody's going to be able to put their body into the same lines or something is sometimes is a counterproductive idea.
Right. Especially like crossing the feet, just sitting in that lotus position, right? Just crossing your feet together. So some knees will be able to get down to the floor and some knees won't. And if you have anteverted femurs, and because your knees, if you have anteverted femurs, your knees shouldn't be able to get down to the floor as well. But if they do, then that means that you're likely hypermobile. And that creates a whole nother host of problems, like you've mentioned earlier.
Right, right. Well, I guess the other part that I'm kind of curious about is that I do a similar thing that you're doing, which is I think that there's ways to put out principles or concepts, just like you were saying. Like, I've been to an orthopedic doctor and a physical therapist recently. No one said nothing about whether or not my femurs were rotated. Nobody's talking about it. I'm trying to ask questions like that, and they're like, like nobody knows. Yeah. Nobody's asking those questions. To your point, and I think that there are kind of principles. And I talked to this woman, Esther Gokhale, and we kind of came to a similar point in our conversation where we were talking about kind of the principles, and we can talk about a few more of those because I am curious about that glute thing and the gating.
Sure.
But I would say that what I'm really curious about is that there are these basic principles, but then there's also like you're interacting with me right now. And I've seen some of your like testimonials of people who've worked with you who read your book and got something from it, but then they have one session with you. Mm-hmm. And so I guess I am kind of curious about that part in terms of, is there something specific about you and how you're interrelating with people that's allowing for you to see when you say, I can look at you right now, Jay, if I step back and let you look at my lower body, that you can do one of these assessments. That's only something that can happen if you and I are having this conversation right now, right?
Yeah. So when I say I can look at you and see that, I'm not saying it in some mysterious way, like suddenly all is revealed if I just see you. No, what I mean by looking at you is assessing you. So that's what I mean. And
like observing what you see, basically, right?
I would do my test, my lower body screen that I've developed over these years. So we would test everything. So for instance, this femoral retroversion anteversion is a really big deal, but it only takes 5 seconds to do the test, And then when I get that answer, ding, 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 it goes into my little computer and I say, oh, okay, we've got to pay attention to this more. And then I'm going to, pay attention to other movement habits that you have that may cause problems because of that femoral retroversion or anteversion. But to your point, no, it's not some magic that I have. Anyone can do this. In fact, I've trained all of my therapists at my clinic to do this. So no one gets to work at my clinic unless I've trained them in this approach. And they all see the same miracles that I do because they're not really miracles. They're just understanding how the body works and understanding that pain is a signal that something is wrong now. You can fix it now and pain will go away now. And to that also point, I've created an online training program to teach anyone this approach, coaches to surgeons. I think anyone who's dealing with movement and has people who have ever come to them or will come to them asking about some painful condition needs to understand this stuff. Because you're absolutely right. Yoga has these ideal principles, right? That everyone should look like this and do it like this. And everyone wants to look like the teacher and be great looking like that teacher. But we're all built differently. So if the teacher can understand, oh, well, you likely have retroverted femurs, or just tell the class, hey guys, I can do this because my femurs are anteverted. Let's do a quick test to see whose femurs are retroverted and anteverted, and we can do it in 15 seconds. Yeah, simple. And then you have so much information, and you help your clients understand their body, so they're not beating themselves up because they can't do something. It's easy to do.
I really appreciate that. I think there are a lot of yoga teachers who are coming to sort of what you're saying and looking for new bits of information and ways and resources. And you mentioned, and I know this is sort of like a lot of what you do hinges on, you've said it, like that pain's an indication that something is wrong now. I like the way you put the now in there. Yes. And there's another part of that thing that I've heard you say that your method hinges on, which has to do with bodies having its own self-repair mechanisms. And so I guess I am curious about that because it does seem like the body often does know how to take care of itself, and it's like creating the right conditions for it to do that. That's a kind of concept in yoga practice, I think, a lot, and other like healing modalities. So how do you see that? Because it does seem like you are looking at things from a primarily biomechanical lens, it seems to me. How does that connect to the idea that our bodies have their own ways to heal?
Yeah, you're right. Most of how I look at the body is a biomechanical approach. And this is why I believe that anyone can learn this. It's so much simpler. You don't need a physical therapy degree to learn this. Anyone can do this. I mean, this is why my books help people, because even people who are lay people who have no training in, movement can solve their pain, and they understand it. So it's very simple. But so I primarily look at things from a biomechanical standpoint. And what I have learned, because I've just seen it so many times, is that if you cut your finger, it heals. If you break a bone, it heals. How can these things happen, but us still have chronic pain? If these tissues if the body can repair its own tissues, why is it that we have chronic pain? Well, it can't be about this tissue repair mechanism, because that's working, right? It has to be something else. And from my perspective, you mentioned that 3 pillars of pain idea at the beginning of our talk together, but from my perspective as a physical therapist looking at musculoskeletal issues, I find that if there are musculoskeletal issues, they are creating roadblocks for natural healing to occur. Because it's like taking little hammers that are continually hammering those tissues that are injured. Well, it's like, continually hammering your thumb with a hammer and then putting a Band-Aid on the thumb and not fixing the hammering part.
Not stopping the hammering.
Yeah, exactly. What good is that going to do to put a Band-Aid on it if you're not stopping the hammers? And that's what my approach does, is it identifies and stops all of these hammers that are hammering our body, and they're unconscious hammers. They're all about how you're using your body is causing this type of stretch. And that idea with this femoral retroversion that we just went through is one of the ideas.
I really appreciate that. One thing I have noticed, and it's why I decided to go to other people and let other people look at what's going on, is that it seems like the idea that you have about your body often shapes what your body is. And if you change that idea, you can make changes in your body. I've seen that happen in my own body. I had an idea about idea of maintaining axial extension as some kind of ideal alignment. And I caused a lot of issues for myself with that. And then at some point I met some somatic movement modalities, and they were like, hey, curves of your spine have a really important function. You might not want to be forever trying to undo them. So that idea, just shifting that idea, actually changed what was happening in my body. So I really appreciate that you're talking about giving people information or educating people, essentially, so that they have an idea about their body that's helping them move better, which I think is what a lot of yoga teachers are trying to do as well.
Yeah. So I just want to, a little caveat to what you just said.
Good.
The shape of the curve of your spine is what it is. It's the forces acting on the curve that are things that you can change. And it would be like me pushing it as hard as I can into your chest with one finger, Jay, as hard as I can.
If you are hearing this message, then you're listening to the free version of Jay Brown Yoga Talks. To hear the rest of our conversation, please subscribe to Podcast Premium at jbrownyoga.com/premium.